All right. I would like to introduce to everybody my very first guest on the show, Dr. Kimberly Melvan. She is a local physical therapist here in Fort Lauderdale with about 13 years experience in sports medicine and specializes in runners. So welcome, Kim. Glad to have you.
Thank you. Happy to be here.
Go ahead and tell us and our audience a little bit about yourself.
Yeah. So I grew up in Kansas and I went back east to Massachusetts for my undergraduate education. I played basketball while I was there in school. Knew I wanted to be in medicine, didn't really know what I wanted to do. And our strength and conditioning coach was a physical therapy assistant. So he told me to go and do some observation hours. So on one of my summer breaks from school, I went home, got hooked up with a physical therapy clinic nearby, went and did some observation hours and absolutely fell in love with it. It was a perfect mix of what I wanted to do. I didn't want to be in an office setting, seeing people for 8 minutes at a time. I didn't necessarily want to do a lot of schooling. So it seemed like a perfect fit. I could be active, I could use my brain, not sit behind a desk. So it seemed like a really good fit. So kind of started most of my later undergraduate education tailored towards physical therapy classes or what I would need for my prerequisites. And then ended up, after I graduated, moving back home to Kansas and going to the University of Kansas for PT school. So when I graduated, I thought about doing traveling PT. So I applied for my license in DC and in New Orleans. And my godparents living in New Orleans said, well, why don't you move down here? You can stay with us. So I moved, didn't have a job, ended up working at a clinic that my godparents' son was a patient at and actually knew the physicians there. And it ended up being my dream job. It was a physician-owned practice who used to be the doctors for the New Orleans Saints before a bigger hospital group came in. So it was like all high-end athletes, like
Wow.
perfect. So being, in that orthopedic setting, I was like, oh my gosh, this is fantastic. As a new
that's
grad,
like a dream job coming out of college.
Yeah, it was phenomenal. I still miss it to this day. It was a great job. I learned a lot. I met a lot of great people. So it was a really nice introduction to kind of get my feet wet. I got my strength and conditioning certification while I was there. And then I think I also got this is awful, it was so long ago, but I think I got my kinesio taping certification there as well. But I was there for 3 years and then moved to, this is mostly about business, I guess. I haven't really talked about my personal running journey. But I did get into running when I was in PT school, just to kind of keep myself active and busy, not playing basketball. Found out that I really liked it when someone wasn't yelling at me to run faster on the court.
Right.
I was kind of doing it at my own pace. So I always kind of tailored my continuing ed towards running related education.
Okay.
Just because that's what I was interested in and I was doing it. And so it kind of was always in the background. And then I ran my first full marathon when I was in New Orleans, but running one of my half marathons, I met my now husband running that race. And so I was there for 3 years, and then we moved to Atlanta for his work. So we both ended up actually working for Emory. So I worked in a spine clinic for about a year. They were looking for someone in that clinic setting. I was more orthopedic based, but they needed somebody who needed a job. So I said, hey, let's try it out and see how it goes. I learned a lot, but I also learned that I am not a spine-based therapist, which is fine. But they actually had an opening in one of their outpatient clinics that was more like joint replacement based as a manager. And so I took it. And it ended up being a really great opportunity for me. I was the youngest manager in that setting, the first female manager, did really, really well in that type of environment. And I had a really good support system. Emory does a really good job of evidence-based practice. So, it was a lot of, why are you doing what you're doing? It really makes you think and not just go through the motions. They're very big on learning continually. I mean, even people who are out for, 20 plus years, you can always learn something new. And so that was a
Mhm.
really great setting to kind of grow, as a PT, and they helped me foster, my love for running. So not only did they help me take those classes, but they allowed me to kind of expand my knowledge. I said, okay, if that's your niche and that's what you want to do, let's do it. So,
Oh, that's awesome to have that support.
yes. So I started the Emory Running Clinic. So I basically saw patients kind of outside of clinic hours. It was a cash-based system.
Okay.
Um,
What
but
and
it's
what year was this that you started this the cash clinic with runners?
So it was probably, oh my gosh, maybe 2015,
Okay.
2015, maybe. Yeah.
Okay. About 8 years ago, a little before the cash-based time.
Yes. Yeah. Yeah. But it was
Oh.
really nice. I kind of hooked up with the Emory physicians that were more running medicine based, and they would kind of
Mhm.
refer those patients. So it worked out really well. It was maybe those patients that we weren't seeing in the clinic setting anymore, or who had kind of gone through PT and now were ready to like really get into running and training. And also people who weren't necessarily injured, but wanted to, work on their gait. It was a lot of gait
Right.
analysis, running focused work, which was great because that's what I loved. I appreciated the setting that I was in, but like I said, it was more joint replacement, orthopedic.
Right.
So it wasn't necessarily, there wasn't a high running population. So it allowed me to kind of bring that in, and merge them, which was really nice.
That's awesome.
Yeah.
So since 2015, so it's been
Yeah.
about 8 years now you've been working with runners. That's amazing.
Yeah.
What have you found to be the most common pain, location, or injury in runners?
Yeah. I would say for women specifically, it's a lot of hip and glute issues, and knee related issues in general. I think knees for males and females, I think are high injury rate. And also
Mhm.
Achilles tendonitis, like a lot of overuse injuries. So anything you can think of that's like, oh, I worked that muscle too hard, you're going to see
Mhm.
that with runners. I think it's a lot of running, a lot of mentality of runners is very type A driven, like I'm going to do
Of
this to
course.
the nth degree. And so you just see a lot of those overuse injuries, whether they're like training too hard, too fast, whatever the case is.
Have you found dealing with, that type A population, you've become almost more of a psychiatrist as well and trying to reel them in a little bit
Oh yeah,
as far as like,
absolutely.
this
And I
is the
think being a
rehab, you
runner
can't run a
myself, yeah, being a runner myself, I understand that. I get that, and
Mhm.
I'm sure you deal with this a lot too. A lot of times people will say, well, just stop running or just don't do that. And you can't say that. And you shouldn't say that, right? Like
Right.
there's a time and the place for that. But I think if you modify and you change things enough,
Mhm.
you can get around that. But yeah, it's a lot of mental struggles, I think.
Yeah. So over the past 8 years, I know shoe mechanics and shoe design has changed a lot, with the intention of making us faster, I guess more aerodynamic, we could
Mhm.
say. Have you found any correlation in your experience of treating runners with shoe type and injury?
Yeah. I I think I think most people need to know there's not like a perfect shoe. Like there's a lot of information out there as far as like this is the best shoe, this is what you need to be wearing, but every runner is different and every shoe is different. So
Mm-hmm.
bottom line, I always say if it's comfortable and feels good, it's probably the best shoe for you. Like you can kind of like block out all the other noise. If it
Mm-hmm.
feels good, it's probably good for you. It depends on your foot strike pattern. If you're trying to change your foot strike pattern, like that plays a lot into the type of shoe. For me
Mm-hmm.
personally, I'm a heel foot striker. So those more cushioned shoes I gravitate towards because I'm on my heel a lot. For someone who's a midfoot or
Mm-hmm.
forefoot striker, those less cushioned shoes are probably going to be better because they don't need that cushion. If you're
Right.
trying to transition your foot pattern or transition in and out of a shoe, you have to kind of think about, okay, what's the difference? Like what are my muscles going to be doing? Am I going to be using my Achilles more because I'm on my forefoot more? Do I need to incorporate some more of that strengthening, into my schedule to transition into that? So, it kind of depends on where your starting point is and where you want to be. But everybody's different. So it's hard to say kind of, what shoe is good for, for
Yeah.
everybody, right?
I think that's excellent advice. I know patients ask me all the time, what's the best shoe? What should I get? And I'm like, I don't
Yeah.
know.
I wish I
I
had like,
don't know
this is
how it
it,
feels.
like A, B, and C. Yeah. And people hate to hear that, right? Like, well, it
Mhm.
depends, but it really does depend.
So our listeners who are in Fort Lauderdale here, I'm familiar with two stores that are pretty good with shoe fitting, and that's Running Depot and Running Wild. Do you have any other recommendations where people could get some recommendations for their footwear?
No, I mean, those are kind of the two hot ones.
Okay.
I have a good relationship with Donna at Running Wild, so I will typically send people there more often, but I know Running Depot has a really great relationship. I feel like Fleet Feet is another one that I've heard.
Okay.
Um, but yeah, anywhere where they're going to actually put their hands on you, put their eyes on you and see how that shoe fits, watch you run in that shoe, is helpful. I also will recommend buying a couple different pairs of shoes, taking them home if you have a treadmill or access to a treadmill, and running with them on a treadmill to really see how they feel. And then you can return the pair that.
Oh, that's an excellent idea because running is definitely different feeling than walking just
Mhm.
around the store.
Yeah. And
Okay,
some
good
stores have
advice.
treadmills and they'll let you run on it. But I think it's different, right? Like running a couple feet versus like running, a quarter of a mile in the shoe. It just gives you a different feel.
Right. Good advice.
Hmm.
What are two of the most valuable lessons that you've learned along your own journey as a runner that you can share with our listeners?
That's a good question. I think taking things gradually, a lot of times you want to, like I said, runners want to go from 0 to 100. But that gradual adaptation in anything that you're doing is super important. So if you're changing shoes or you're starting a training plan or you're starting a new workout, ease yourself into it and allow your body to adapt and make those changes slowly. So that way you can really see how your body's going to respond. I think that is sometimes easier said than done. And I feel like the other one is it's okay to rest sometimes. And I find that I have a hard time with this as well. Even if I say, okay, I'm going to take a day off of running for the week, like mentally that it's so hard for me. And I know other people are in the same boat. It is okay. Like sometimes you just need a break and that is
Mhm.
okay. Your body does a pretty good job of telling you what you need. You just have to actually listen, which is the hard part.
Mhm. That's excellent advice. Um, so those had two positive outcomes in those lessons. What is the most painful lesson that you've learned?
Yeah, I guess this one kind of ties into the rest aspect. Personally, I have dealt with a lot of posterior tib tendonitis, and knowing when to back off or ease myself out of something is hard, right? If you're injured and you're trying to figure out what to push through and what not to push through, I think sometimes you can do more harm than good. Whereas, if you give yourself a day of rest, you could be good to go. But if you push through, then that's going to set you back, or you could be at risk for stress fractures. It kind of spirals if you don't nip it in the bud.
It's tough when, you have the pain or the injury yourself as a physical therapist and you know what to do and you know exactly how to do it, but it's that mental part of you have to reel yourself in
Yeah, it's so
to
much
make it
easier
happen.
to preach than to practice. I say that all the time.
It is. Is there anything else that you want to share that would be of value to the audience, whether it's just in fitness in general, specific to runners, anything of value?
Yeah. I think it's important to remember that everybody is different. I think there's a lot of noise out there, especially, with social media and access to everything. There's a lot of, well, this is the best diet plan and this is the best workout and this is the
Mhm.
best shoe. But everybody is different. So I think putting yourself in the right community is super helpful. I think everything needs to be multidisciplinary. And we touched on this a little bit before, but I don't know everything. I know a lot about certain things, but I think being able to identify, okay, like this isn't my strength, let me hook you up with somebody who knows more about that. Kind of putting yourself in that environment to reach out to those experts that maybe know more than more than yourself. I think that's really important. And I love that about the running community here in Fort Lauderdale. Everyone is very, very community driven. I haven't really, some environments you go in and everyone's very competitive and they don't really want to share and they don't want to, work together. But I find that that's not the case here, which is really nice. And it's a big running community. I mean, just the sheer
Right.
fact that you can literally run year round. It's nice. It's fun. So I think putting yourself in a position to say, okay, well, that sounds good, but maybe that's not the best for me. Let me, reach out to someone who may be able to help me with that is important.
Well, that's an excellent segue into my final question of how can people find you to learn more and follow you?
Yes. Okay. It's very easy. Run Coach PT. That is my Instagram handle. That's my email. That's my website. So you can email me at kim@runcoachpt.com. My website is runcoachpt.com. I think I gave you my cell phone number. I don't know if it's going to be posted anywhere, but feel free to call, email, text, reach out to me on Instagram or Facebook. Everyone's pretty easily accessible nowadays, so
Right.
try and make it simple.
All right. Well, thank you so much for joining us
Yeah,
today and for sharing your experience, sharing a little bit of your story. I'm sure all of our listeners are going to take a lot away from this. So thank you so
yeah.
much.
Thank you for having me.
You're welcome. And I will see you in May.
Yes.
Anybody who's listening who is local, again in Fort Lauderdale, Kim is hosting a running workshop May 20th at 9 a.m. And remind me of the location.
It's at River Market in that turf green space area.
Okay. All right, great. So I will be a guest there, and we're going to have some other professionals from the community come and share all things running. So again, if you're local, and where can they sign up for that?
On Eventbrite. If you look up Spring Fort Lauderdale Running Workshop, it's on there. I'm
Okay.
trying to distribute flyers throughout the community, but you could also reach out to me to get more information.
Okay. And I think wherever we post this podcast, we can also attach the link to that. So it's super easy if you hear of it from listening to here. So, all right. I will see you then. Thank you
Perfect.
so much. Enjoy your weekend.
Thank you.
Bye.